You are a passionate body worker and a massage nerd? Is that the case? Stay tuned. I am Ulf Pape from Germany. I have been teaching massage therapy, osteopathy and physical therapy for 30 years. In this tutorial you will learn one of many techniques for the treatment of the diaphragm and the thoracic spine. Here we go. Use your lower hand as a lever so that you can slide your fingertips under the transverse processes around the 6 thoracic vertebrae. Lift the client's rib cage upwards. Place your other hand on the client's chest just below their breast. As the client inhales, you use a levering motion to lift the thoracic spine upwards. Your other hand rests on the rib cage using its own weight. Your hands thus follow the rhythm of the client's breathing. The spine and the rib cage relax. Breathing becomes calmer and deeper. Your lower hand then continues to glide towards the client's lumbar spine, moving beneath the transverse processes of the lumbar spine and finally to the sacral foramina. This sandwich technique is deeply relaxing and is ideal for relieving stress and back pain. Now place your fingertips on the transverse processes at the thoracolumbar junction. Apply pressure to the transverse processes, again using the lever formed by your lower hand. The fingers of the upper hand move between the lower intercostal spaces, gently guiding the rib cage in the time with the client's breathing. This way, you can achieve a great deal with very little effort. I hope you enjoyed this little tutorial. Don't forget to subscribe to the channel. Thank you for watching.